Hello everyone, it's Dr. Ida Khan and welcome back to our channel Medico's Guide. Today, we are delving into the world of lymphomas and uncovering the key differences between Hodgkin's and non-Hodgkin's lymphoma. So, let's jump right in. First, let's talk about the lymphatic system. It's a network of tissues and organs that help rid the body of toxins, waste, and other unwanted materials. It is composed of lymph nodes, lymphatic vessels, the spleen, thymus, and tonsils. Lymphomas are cancers that begin in the lymphocytes, a type of white blood cells that are present in the lymph and they are transported throughout the body to fight infection and diseases. Now let's talk about the Reed-Sternberg cells. Reed-Sternberg cells are large, abnormal lymphocytes found in Hodgkin's lymphoma, and they are characteristic of the disease. They are used to diagnose Hodgkin's lymphoma under a microscope. Hodgkin's lymphoma and non-Hodgkin's lymphoma differ in several key ways. Let's break down the main differences between these two types of lymphomas. Now let's talk about the differences. So first is the cell types. In the Hodgkin's, there is presence of Reed-Sternberg cells. As we already know that the Reed-Sternberg cells are the characteristic cells of Hodgkin's. Now in the non-Hodgkin's, there are various types of abnormal lymphocytes. So as we already know that there is presence of leukemic phase and hepatosplenomegaly that is found in the non-Hodgkin's, while there is absence of Reed-Sternberg cells. Now let's talk about the lymph node involvement. So in Hodgkin's, it typically starts in single or the group of lymph nodes, and often these are the upper body lymph nodes. Now the non-Hodgkin's lymphoma, it can involve multiple lymph nodes throughout the body. Now let's talk about the spread. So in the Hodgkin's, usually it spreads in orderly manner from one group of lymph nodes to the next, while in the non-Hodgkin's, they may spread unpredictably throughout the body. Now, the treatment response. So, in the Hodgkins, they generally are highly responsive to the treatment with high cure rates, while in non Hodgkins, the treatment response varies widely depending on subtype and other factors. Now, talking of symptoms, Hodgkins and non Hodgkins almost share the same symptoms. They are painless and they have swollen lymph nodes, fever, night sweats, unexplained weight loss can be seen. Now the causes. So the Hodgkin's lymphoma here, the exact cause is unknown and possibly it can be genetic or viral. While in case of non-Hodgkin, the exact cause is unknown as well and possibly it can be genetic, autoimmune or viral. Now let's talk about lymphocytes. So in the non-Hodgkin's lymphoma, both B and T lymphocytes are present, while in the Hodgkin's lymphoma only B lymphocytes are present. Now let's talk about the classification. So the Hodgkin's lymphoma is classified into classical Hodgkin's lymphoma, nodular lymphocyte, predominant Hodgkin lymphoma, while the non-Hodgkin's lymphoma is classified into B-cell lymphomas, T-cell lymphomas, and other rare types. Now let's talk about the types. So the Hodgkin's lymphoma has four subtypes: nodular sclerosis, mixed cellularity, lymphocyte rich, lymphocyte depleted. While in the non-Hodgkin's lymphoma, it has numerous subtypes, including diffuse large B-cell lymphoma, follicular lymphoma, mantle cell lymphoma, and T-cell lymphoblastic lymphoma. Now, these tables summarize the key differences between Hodgkin's lymphoma and non-Hodgkin's lymphoma across various aspects, including demographics, clinical features, diagnosis, treatment, and prognosis. Talking of age first, Hodgkin's lymphoma often strikes young adults and older adults, that is at the median age of 39, while non-Hodgkin's lymphoma can occur at any age, with a higher incidence in older adults, that is in the median age of 59. Now, talking of gender, so both types of lymphoma show a slight male predominance. Regarding race, Hodgkin's lymphoma is more common in Caucasians, whereas non Hodgkin's lymphoma shows no specific racial predilection. A family history of Hodgkin's lymphoma increases the risk of developing the disease, while the same is true for non Hodgkin's lymphoma. Now, risk factors. Hodgkin's lymphoma is associated with factors like Epstein-Barr virus infection and a weakened immune system. On the other hand, non-Hodgkin's lymphoma risk factors include a weakened immune system and certain infections like HIV and hepatitis C. Now, regarding incidence, Hodgkin's lymphoma accounts for about 10% of all lymphomas, while non-Hodgkin's lymphoma is much more common, representing around 90% of the cases. Now, talking of the sites, Hodgkin's lymphoma typically begins in a single lymph node or a group of lymph nodes, mainly in the upper body. Non Hodgkin's lymphoma can affect multiple lymph nodes throughout the body, and can also involve extranodal sites such as gastrointestinal tract and skin. Now let's talk about clinical features. Both types of lymphoma share common symptoms like painless swollen lymph nodes, fever, night sweats, and unexplained weight loss. However, Hodgkin's lymphoma may present with unique features like itchy skin and alcohol-induced pain in lymph nodes. So now in the Hodgkin's, the common presentation is swollen lymph nodes in the neck, while in the non-Hodgkin's lymphoma, there are swollen lymph nodes in the neck, liver, and spleen. Now let's talk about diagnosis and investigation. Diagnosis of Hodgkin's lymphoma involves identifying Reed-Sternberg cells through biopsy and imaging studies like CT or PET scans, while non-Hodgkin's lymphomas diagnosis require a biopsy showing various types of abnormal lymphocytes along with imaging studies and immunophenotyping. Hodgkin's lymphoma is diagnosed in early stages, while the non-Hodgkin's lymphoma is diagnosed in the later stages. Now let's discuss about the treatment. Hodgkin's lymphoma's treatment typically involves chemotherapy, radiation therapy, stem cell transplant, and immunotherapy. While in case of non-Hodgkin's lymphoma, treatment may include chemotherapy, immunotherapy, radiation therapy, and targeted therapy. Now let's talk about prognosis. Hodgkin's lymphoma generally has a good prognosis, especially in the younger patients with high cure rates. While in non-Hodgkin's lymphoma, the prognosis varies widely depending on the factors like subtype and stage, with some types having better outcomes than others. Now, these tables provide a concise overview of the age distribution and treatment options for Hodgkin's lymphoma and non-Hodgkin's lymphoma, highlighting their differences in incidence and management strategies. Understanding the differences between Hodgkin's and non-Hodgkin's lymphoma is crucial for accurate diagnosis and effective treatment. If you or someone you know experiences symptoms like swollen lymph nodes, fever, night sweats, or unexplained weight loss, it's essential to seek medical attention promptly. That's all for today's video. Don't forget to like, share, subscribe for more educational content. Thanks for watching and take care.